Firstly, I'd like to thank everybody, particularly Phyllis and Randy Marie and everybody involved with the conference. It's been amazing. The presenters have all been amazing. Their presentations fantastic. So it's been wonderful. Thank you. So let me just. Now all of a sudden this doesn't want to work. I don't know why it doesn't want to. I now can't. Where's my cursor? Okay, right. Thanks. New Light on Fields is part of a 10-year journey of mine into researching color visual fields, or what I like to call them fields of awareness. It describes a method of analyzing fields that evolved from what appeared to be a diverse array of subjects. What emerged was a process that empowered people in their journeys towards physical and emotional wholeness. My journey holds optometry as the core discipline, and additional to that knowledge, behavioral and syntonic optometry widened my visual horizons. My earlier training in traditional Chinese medicine allowed a melding of Eastern and Western diagnostic tools into a map of the space that surrounds you. It expanded into the psychological aspects of visual perception, and my ongoing work with gifted children revealed another field pattern that built on my base of knowledge and looked at the connections between high cognitive ability and visual awareness. Finally, it uses our visual awareness as the indicator, the detector of meaning in our lives. These very different disciplines were drawn together into a visual coaching model that embraced the ancient ways of analyzing the body, the symbols of vision, the field of consciousness, and light. The map of our visual awareness defines who we are and how we deal with the physical and emotional issues that arise during our lives. Our fields reveal the hidden reality of our personal space, and bringing this to conscious awareness in the exploration of that space presents us with the opportunity to feel empowered and in charge in our life journeys. I think that fields of awareness are the key to understanding human potential, and the development of the interpretation of these fields using different paradigms will allow a more rapid advancement in the understanding of the effects of light on the human system. Arnold Mindell, whose work I think is amazing, asked, how do we discover more about the mysterious and invisible edges which organize our fields of awareness? Light fast tracks us to these edges. In pairing the visual field with an iridology chart, it was so exquisite in its simplicity. I didn't have to think about which way around I had it. Was it upside down? Did I need to turn the field around or the chart around? It just happened just like that. And I discovered this amazing man, Murray Gell-Mann, who's a biophysicist and Nobel Prize winner for the discovery of quarks. And in describing how he decided to choose which theory was correct, I think he said he had 7 theories for the discovery of quarks. He laughingly said that science didn't come into it at all. He said that of all the theories one dreamed, it was always the most beautiful and elegant theory that was correct. And matching this chart just happened like that. It just felt the same. This is a picture of a gluon and a quark paired with a quark, which is amazing. It looks like an iris. And so what I have done, seeing as there's not much color in visual fields except thin little lines, is I've sprinkled quarks, pictures of quarks, throughout the presentation. So each time you will see another one that, as I say, I'm sure made Murray Gell-Mann laugh even more. So using an iridology chart laid on top of the field, the distortions in the field accurately matched the indications on the chart. The intention is not to diagnose physical disease, as an iridologist will do, but to give an indication of the energetic imbalances that are present and what light processes would be beneficial in achieving a more flexible and balanced system. An iridology chart happened to be on my desk when I checked the fields, let me just go to the next, of a friend of mine who had cancer and who was searching for the reason why she could not reverse the course of her disease. That day is imprinted on my memory because the impact of this experience was to change the course of my life and also of hers. I had offered her the gift of as much light and whatever work that I could do for her, and her journey became mine, and in the discoveries that followed. So this is the iridology chart that I use. It is Dorothy Hall's book. It's the only thing that I specifically use from her book, but I use a transparency, so just a clear transparency that I just lay over the chart. Oh, there's another quark that's popped up. Okay, so this is the field that began my search 9 years ago. My friend was suffering from severe depression and feeling worthless and fearful and exhausted, having attempted all kinds of cures for her cancer and none of them working. Through all of this, she said she wanted to live. As I measured her field, she seemed to be having difficulty seeing the blue target at the 90-degree line and seemed to become anxious. She kept moving away from the chart and back again, and because she knew she couldn't see it and didn't understand why she couldn't see it. I noticed my iridology chart lying on the desk, which normally is not there. It's somewhere else, but it's never normally, there was no reason for it to be on the desk. And my eye landed on the 90-degree line, which is connection to life. And without even thinking about it, I just said, "You don't want to live anymore." She turned around and looked at me in complete shock and then burst into tears and said, "You are right. I don't want to live anymore. I have no desire to live." The target that we introduce into someone's field is like a signal in the wilderness of our silent and diminished awareness. It is there to wake us up. Ursula died a few months later, but in a far more empowered and peaceful place than on that day. And I journeyed on with my little iridology chart, because then it became something that I didn't move without, and I searched everybody who had anything. They were invited to come and have a field done, and I pasted my chart on top. What's interesting here for me, looking back at that, is that in this area, the dip in that area, had I known what I know now, I would have been able to say to her, "You have a great deal of anger, rage that is underlying, and it's on your relation line. I will look at the green line as the relationship line." And in fact, her desire to die was because her husband was having affairs all over the place, and she couldn't acknowledge it. She actually didn't acknowledge it until after she died. She then came to me in a kind of a dream, and she had resolved it, but she didn't actually resolve it before she died with her husband. She resolved every other relationship in her life except for that one. What's interesting also about that from Jan's talk yesterday is when he said that the cancer cell looks externally normal, but is internally abnormal. To me, this sort of signifies what happens in a field, is that it shows you the hidden area, our hidden beliefs that nobody else can see. You put out this front, or maybe your white field is very large and it doesn't show anything, but inside is your real desires of what you want to do or what you are truly feeling. This, and I am writing a book which hopefully is going to be out next year, so all of this will be in the book, and this is not very well or clearly written, but it's really just my combination. I've wrote it all out on one of these charts, and I basically refer to it every time, and I've added and added to it from various people. Farida Sharan's book on iridology is amazing. She's really, really great. And Denny Johnson's book also on iridology. So I have pulled from a visual awareness perspective and just made the connections into a chart. And of course, traditional Chinese medicine principles, so the right eye is the male energy, the outgoing energy. I like to look at it as being your money. So when I see people and their visual fields are very diminished on the right side, then I know they're spending too much money in their energetic bank. And I say that, and everybody understands money. And if you spend too much, you are not going to have much left. You're not going to have energy for anything else. So it combines a variety of different. This is the disharmony-harmony line here. So when I see an oval field, then I know that there's probably a hyperactive thyroid or a manic state of being. And then this is the connection to lifeline and the groundedness down there. This is your survival. So when people are in survival mode, you will see it's the back area, but it also is very diminished. There is the sort of liver area, and again, it's resentment. There is the grin and bear it, which I'll show you a field of, and how you express. Are you actually expressing truly what you need to? Then, of course, the left side is the female, intuitive, internal sense of self, and is about how much store of energy have you got. So again, I say someone has a large field on the left side and a small field on the right. They are doing things to build their internal energy, but they're letting it leak too quickly. They need to stick their thumbs in the dike in some way to block up the. And of course, if it's very small, they have a diminished sense of self-esteem. So field changes are a patient's subconscious way of communicating their discomfort. Looking at and diagnosing a field requires us to have an elastic awareness. We are trained to look at what remains of the field, but what do you see when you look at what is missing in the field? This is a full field, theoretically. Supposedly, I don't like saying you should be there, because I actually believe that you shouldn't be anywhere. You should be wherever you are. But this is what we traditionally regard as being a full field. And so, but what is outside of that field? What is here? When does your field become mine? And what happens at the boundary of our spaces? Is it a factor in conflict resolution? And would understanding how our fields blend have an impact on global peace? I spend my life thinking about everyone I meet, and I wonder, how big is your field? So where are you focused? Are you focused internally, or are you focused in an expansive way? And just sometimes being curious about people's fields of awareness helps you to feel less anxious yourself and more aware that other people actually probably have very similar feelings to you. That's okay. During this time of research, I'd begun studying counseling and coaching, and I expanded the interpretation of the field of awareness through the development of a visual coaching model. These experiences are always from my own personal experiences, that I have a profound experience with someone, and I did in a coaching session, and then it just became something that I started to use in my work. So my model really is, it's an inspirational, conversational process that through visual awareness or awareness encourages the emergence of dreams, desires, and peak performances. The coaching interventions that I use support the process of visioning and visualization as paramount to accessing human potential. Coaching on a visual field reminds the client to look beyond the boundaries of their limited vision. And there are so many amazing people like Arnold Mandel and Irvin Yalom also, his books and what he says are just astounding. And what he says here is so true for all of us. Ordinarily, what we can do slips out of our awareness, and we are completely unaware of it. In our searching, we seem to so easily lose sight of who we are. Here's another quirk. So I then began seeing suddenly an influx of gifted children with learning difficulties who were referred to me by a psychologist, and discovered that combining their visual perceptual analysis with their fields produced a powerful indicator of our preferred learning styles. And I like to call it your preferred cognitive uptake. So rather than defining it as intelligence, it's how does your brain actually, what's the juiciest part or way that your brain can take up information. And Joseph Trachtman, who's a very well-known optometrist, and he's developed some instrumentation that's very good instrumentation, he uses specific, very sophisticated instruments in evaluating cognitive processing styles. He measures EEGs, but this isn't feasible in private practice. For all of us, we need something that you can actually use in practice without having huge machines or large financial outlay. And I found that in matching these fields, let me just move on, there's what I call a diminished spatial field. So in other words, a child who had a high spatial, visual spatial perceptual scores. So in other words, their brain really enjoyed learning creatively and intuitively. And I expected, because of this child's learning disabilities, in actual fact, even though he was highly gifted, I expected him to have a tiny little field. And instead, it was not still diminished, but certainly not minuscule. So I then discovered that the center field is the word. The peripheral field is image or imagination. I believe that we are formed in the illusional periphery, and that we, in 360 degrees, as we move through as a child, we are born, we start moving through, we are very intuitive as little children, and then the drive is to eventually become a reader and know the word. And so as we move and we continue moving in and away from childhood or through our childhood, then you're told to forget all the fantasy, and learn the words and learn how to read. And so our drive for all of us is, we are not good enough unless we can do it verbally. So our fields just get smaller and smaller and smaller if you continue in. And for a visual spatial child or somebody who is creative and intuitive, then they don't like learning with words. They like learning with images and taste and touch and sound and feelings. And so what's missing in their field, which is all of here, is the way that their brain best likes to take information in. So when that diminishes, then you can feel okay about yourself to a certain degree with that field, and particularly if you're gifted, because you're on such a high level anyway, you can do it. But in actual fact, you do it with such a diminished sense of self-esteem, because you can't actually access your brain's best way of taking information in. So then when you go to what I call it's a visual sequential, auditory sequential field, then that's the other end of the spectrum, which is somebody who's highly structured and perfectionistic and very, very competent verbally. They don't care about the periphery. In fact, one gentleman whose child was on the autistic spectrum said to me, I did his field as well, and his field was very similar to his son's, which is about 5 degrees. And he said, I never really got fantasy. I have no idea what anybody sees in fantasy. He was a lawyer, and very competent lawyer in actual fact, but he functioned with a 5-degree field. He had no body language, IQ, EQ at all. But he was functioning in his life very well. There's nothing wrong with you if you have a tiny field. You just love taking in information into your brain through the word. So we think we have to let go of fantasy in order to grow up and become competent and admired. So we do everything that we can to reach the center. And for those of us who love learning intuitively or creatively, this is so diminished when we find that we can only learn verbally, and our intuitive abilities often disappear. One of the things that I also discovered, and again, many of my discoveries come from my own personal traumas or journey, and that is my own field has been quite small throughout this 10-year period that I've been doing them, and I have many of my fields. Not quite as small as that, but it has been small. And yet I am able to access my intuitive abilities. And I realized that when a visual spatial or a creative person is driven through stress or trauma into this kind of field, then unless anybody stops it, you are almost dying. You're just closing up into this tiny little hole. But so children who are highly intuitive or creative and who are in a traumatized home space or school space, they'll go into a daydream. They sort of dissociate. And then I know I do myself, is I leap out of the field and move to the periphery. So I can be in the room, but I'm not in my body. I'm out on a tree somewhere and I'm seeing all kinds of things, and it's so safe and it's so nice out there because nobody can touch me. However, what happens is you have to inhabit your body in order for your body to function well. So if you keep leaping out of your body, you're going to have troubles with your body. Your body is that you're going to have accidents or some kind of trauma that's going to try to drive you back into your body again.
Denise, also, I have family patients that unless they can resolve the trauma through their bodies, that's the main reason that I find for people to go back and re-inhabit the body with the trauma.
Absolutely, yes. Absolutely. And so when you use light and you increase a field, what you are doing is you're saying, okay, don't worry, it's okay, you can come back here because here's big enough to come back to now. But it's the trauma for someone who is that size. Very often children will open up a little bit, so you'll get a 2-degree field that opens up to maybe 5 degrees or 7 degrees, and that's it. They stop there for a while because it's like, you just took me to the edge of existence, and I don't know what is out there. It's blind. There's nothing. Nothing exists out in the periphery when you have a field like that. It just doesn't exist. It's like, as we say,
and in a way that's where the trauma resides.
And that is where the trauma resides, yes. And when you're doing, what's it called, REM, when you're doing rapid eye movement, and you're moving from one, what you're doing is you're taking them from one peripheral field to the other peripheral field, which doesn't exist. So when you do that, you're going trauma, 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 trauma. Remember the trauma, go there, go there, go there. And so it can be, unless you are held in a very safe space, it can be utterly terrifying. So I like to look and describe the continuum of intelligence, and particularly when I'm doing report backs to parents on gifted children who, they come, they know their child is gifted, they know that they don't understand why their child is not functioning properly or well in school. And so I look at intelligence on the continuum. It's a line that's just, one end is highly creative, the other end is kind of the highly focused, driven, more structured person. And then there's in between, and there's all of us who we're either one side of the midline or the other. And if you know that you are one side, the creative side, then and you can't understand how to relate to your husband or one of your children, seeing that and understanding that they don't see it from your perspective. They see from a totally different perspective. The people on the high focus end won't use image. They don't want to use them. They don't like learning that way, so they're going to avoid it. And if you get somebody who's highly focused and structured, who says, come on, don't you understand, and they give you a set of numbers like that, then a creative person will go, I don't even want to look at that, because it isn't the way my brain likes to take information in. You might be able to give them information that's like this, and then they'll go, oh, I can see the whole picture. But you won't get them to understand unless you understand yourself that people are just looking from a different direction. So global thinkers learn with image. And when they learn this way, they know it forever. Imagery is the internal communication outlet for emotion and is the means by which emotions and feelings are translated into language. So, of course, when you lose your periphery, you lose your capacity to intuit what people are thinking, and then your self-esteem will diminish as well. Then the others are so I have called it the image and the word, that it's the peripheral field and the center field, and Joseph Trachtman in his work has said it's theta, which it is, it's beta, alpha, and theta. Hopefully, when you have a 15 or 20 degree field, you are in a state of balance, of good flexibility. Elliot Forrest called it inclusive and exclusive. And really in coaching, you're talking about global big thinkers or else very focused thinkers. And there's another quark. So understanding your preferred cognitive style is the reason for your lack of achievement or ability to engage comfortably on a social level, and not your brain capacity, is enormously empowering for both adults and children. When I do report backs and I start talking about a child and explaining how I see this child as being able to function, it's quite astounding that very often the fathers will sit there not really enjoying being in the report back session because they think it's a waste of time, until suddenly they realize, hold on a moment, this actually is how I am as well. And I have a boss who is like this and is doing this. Is that why I can't relate to my boss and I don't understand, or we just are at loggerheads all the time? So it has ended up actually being the most powerful way to look at a family unit, and certainly in coaching to look at it systemically and say, this is not just the child, it is the whole family. If you can get the whole family to understand where each of them sit on this continuum, then it's just so much easier. We know that visual awareness affects human behavior. Our limbic brain has been pre-programmed by our early and ongoing life experiences to react to potential danger, and our awareness shifts accordingly. We know that visual awareness accesses human potential. And as Jacob said yesterday, sportsmen and women are unable to enter the zone without an ability to visualize, and this is dependent on visual awareness. We also know that visual awareness creates instantaneous healing and understanding by shifting your viewpoint, or seeing the bigger picture, or discovering the missing piece. I can relate a nightmare that I had for the first 30 years of my life that was really debilitating. I dreamed that I was in like a little Volkswagen bubble car, and that these wolves were surrounding the car and kind of baring their teeth and drooling in anticipation of, I thought, eating me. And the nightmare continued throughout as I say, into my adulthood, where I would wake up in a sweat because these wolves were after me again, and I couldn't understand and couldn't work out what to do about it. I ended up going to a body therapist, not for the dream. I hadn't actually had the dream for some time prior to this, and didn't really know what this woman did. But so the night before the session, I had the nightmare again, which was quite strange. There was nothing to provoke it particularly. And so I told her about it. And in speaking with her, she asked me if I had been in an incubator at birth. And I said yes, that I had. And she said, did I know what would happen with a baby when they were in an incubator? She said people would come around the incubator and look into the incubator and smile and you know, want to get as close to the baby as possible because you can't touch it. And so she said, did it look to me as though the wolves might have been smiling? And as she said that, I realized the wolves weren't wolves. The wolves were the people who surrounded me after I was born. All I could see were bared teeth. I didn't know at that time to recognize it as a smile and as something that was welcoming rather than terrifying. So what she did for me was she took my vision and she shifted it from inside the car or the incubator to right outside. So I had, instead of having fright sight, I had enlightened sight. From that moment on, the dream, the nightmare disappeared. I never had it again. It never bothered me. I understand it. It just is. I know there is no fear attached to it. Nothing at all, not even a smidgen of it appeared ever in my life again. So that's the kind of awareness that is instantaneous. When you see it, you see it. You cannot not acknowledge it. You have to acknowledge it if you've seen it. The reason we don't see it is because we don't want to acknowledge things. So this is the kind of awareness and never to be forgotten experience that most often changes people's lives. So the shape of your awareness can be used to guide you through your life, to determine the silent and hidden areas that you have marginalized through fear, and to allow you to expand and redirect your focus. As Deepak Chopra says, the more boundless your vision, the more real you are. And now I realize I have very little time left. I haven't even got to the fields. The fields that I have to show you are, I've got a huge amount of fields actually, and I'm not going to have time to go through, so I'm going to have to run through each of them. But and they will be new to you. They're not new in my journey. The new experiences, though, I will pick out. The one is disconnections in fields where the line just doesn't join up. The other one is white fields relating to chemical toxicity, or specifically I've found chemotherapy. The blind spot changes that are quite astounding. You think blind spots have normalized through a process. You're going through a light process and it all looks great. And so then I used to stop doing a white field because I thought, oh, it's fine. I don't have to worry about it anymore. Unfortunately, in doing that, I have lost a lot of research information. And then the blue field is an indicator of our unconscious desire to die. I've also found this year, in terms of light, in South Africa anyway, that I have, where I will work on the syntonics principle and decide which colors to use, and that very often we use red, orange, and lime, or else ruby and lime. I have literally not used those colors the entire year. I've had to start, even though I've begun with them, they've been wrong. They haven't worked. And so I've ended up going to violet and indigo as a starter color and doing either 1 or 2 sessions of 10 minutes of each of those, and then running up the spectrum, violet, indigo blue, then blue, blue, green, and then blue, green, and lime as the crossover back to the side of the autonomic nervous system that actually is where they should be, but where they have not been able to access. And I just, it's in kids, it's in adults. I think it's the level of fear and uncertainty and stress that people have experienced this year. oh no, sorry. So let me go back. So this field is gives you an indication of someone who'd had 3 major car accidents, spinal fusion, broke her nose. She was a high myope. She was very, very emotionally unbalanced lady. And when I get breaks, I have thought, well, why couldn't I just join the dots, you know? But what I ended up doing was realizing that I needed to follow the patient, and they would stop. So every time there's a break, they would either move back and do this, or they would do something. They would make some movement, which for a somatic therapist or a coach, and for all of us, in actual fact, we're looking at what people do with their bodies and where it expresses itself in your body. So she was broken in a variety of different places, and I mean if we look at the blue line as being more emotional, it's disconnected along the harmony line, disconnected at the back. So without going into it in any more detailed way, I'll run through each of these slides. This is this lovely French guy who came to South Africa in order to do one of the spiritual and personal development courses. He hadn't told his wife. In fact, he didn't even mind if she thought that he was having an affair, because he would rather she knew that than know that he was actually attending a spiritual personal development course. He was so terrified of telling her. And there is the grin and bear it line, and the blue is the expression and how you verbalize, how you connect. So that was just a really interesting process. And we spoke about it at length because we'd been on the course together, and it was very, very empowering for both of us, in fact. This lady, a drug user, she had a debilitating tremor. She came in she was only 32. She'd been given epileptic medication that didn't work. She was recently divorced, and she was really in a not a comfortable space at all. Again, very difficult to do the field because it's a stop-start. So I do my fields manually, and I do them myself. I can't use a computer program, because as soon as somebody does that, then you can't stop the program, and you can't kind of go in and prod in a certain area. So I prefer a hand. This was her next field. So she did some light. She said she felt as though she was feeling again, as though she could touch again. And so her field, if you look at the previous one, and I don't know why sorry, I'm on the wrong way. Yeah, the previous one is very, very broken and very distorted. So there it's beginning to look more even, and on the lower area, which is the more physical organs, and this is the brain and emotions, it's more solid and grounded. However, at the area of incomplete closure there is actually the shoulder area on the right side, and that indicates a lack of responsibility. So what it told me then was, okay, she's doing well. She'd stopped using drugs. She was actually off the epileptic and the medication. She was on some medication, but that break in her lack of responsibility meant that she would be vulnerable to a setback. If she wasn't careful, she wasn't taking responsibility fully for her life. This is a glaucoma sufferer whose pressures were unstable. She had glaucoma in the other eye. She'd lost most of her vision. She'd had surgery to the other eye, and this was her field. I've put lungs there because that's a lung area. She also had asthma all her life, and she was on a pump all the time. Her next field showed a dramatic improvement, actually, really dramatic, because you kind of look at it as being maybe this is a pathological field loss. It wasn't. Her pressure stabilized. Her ophthalmologist couldn't understand why that suddenly happened. But what was so astounding is that she hadn't used her asthma pump for the first time ever. And that you can see, and of course the blue line is so much bigger there, and I think a whole huge amount of that had to do with her emotions. This lady lost a child, said, I cannot derive pleasure from anything. She had blepharospasm, she'd had Botox to try and change it, but nothing stopped the fact that her eyes would just close. So she couldn't drive, she couldn't do anything because they would just suddenly close. I don't have her next field, but she went through a journey of doing light. Her fields improved. Now maybe I do have her field. No, I don't, sorry. I'm afraid that was one that I got slipped out. But her fields improved, except she still had an area here that was missing. She stopped, even though she was feeling fantastic. She really began to change dramatically, except for that particular area. And then all of a sudden she stopped doing light. She said no, didn't have any money, and her husband didn't believe in it, and so she just stopped. And to me it was an indication that actually she wasn't voicing her needs in her marriage, so her field loss didn't really just have to do with the loss of the child, although that's a huge thing to go through. But it also underlying had to do with, her ability to voice her in her marriage. Okay, wrong way. This lady, fibromyalgia, severe headaches and pain, exhausted, stressed. This is what I call a wobbling or wandering field. And she also couldn't say no to anybody for anything. So she was continually doing far more than she should have done. She got rid of one boyfriend only to walk straight into another relationship that was very similar. And so when a field does that, it tells me, do I go this way or that way? Shall I say yes or no? So it's somebody who's completely indecisive and doesn't know which way they're going. And of course, the higher, the more the peaks and the valleys are, the more traumatized they are through that process. This is a teenager who's doing drugs, and it's one of the early ones that I did where I kind of just didn't do the white field. And sadly, because I think the white field would have shown me the chemical toxicity, he was having psychotic attacks and was severely anxious, and that area up there that I have demarcated is the anxiety zone there. This lady felt so low, her words were so low that I could just let go and die. She really couldn't, and I don't know if any of you have done your own fields. You should do your own fields because it's so powerful to see what you're doing. But when you can't see it, they aren't playing around, they can't see it. And it distresses people to know that they can't see it, actually. So what was it somebody said in one of the talks? I think it might have been Jan, that you raise your, I said it to you yesterday, you raise your, not your awareness, you become more aware anyway. It was something that you said, Jan, it'll come to me. But so she also had huge family relationship problems, but the thing here that I know now is that she said she wanted to die, but actually she didn't want to die. She wanted everybody to look after her, but she didn't really want to die because her blue field isn't smaller than her green field. This guy, antidepressants, back pain, high blood pressure, that's the right eye, left eye, high cholesterol, left eye, Bell's palsy, then he fell luckily in hospital visiting somebody else, he fell and hit the side of his head. This was a few months later. And they whipped him into ICU immediately, and because his blood pressure went crazy, and in fact, he's very lucky to be alive, actually. So it just an indication also that when the white field pulls in and becomes or is about the same size as the color fields, then you are not over trying in order to exist. You're not efforting a huge amount. You've actually just kind of given up. When you go to the other one, where you see the white field is much bigger than the color fields, that tells me someone is efforting too much. They're putting too much effort into trying to do things in their lives. They're copers. This lady also fell. No, she didn't fall. She had, first of all, she'd had a series of things happen to her throughout the previous years, and that was the right, and then there's the left eye. And so she'd had an armed robbery, a traumatic brain injury. She then walked into a door and smacked her forehead on the left side, and then broke her wrist. And at that point, that was the point that she came to me with this one broken wrist, and she was in total fear that she was going to die, because her mother had died the previous year, but she had also broken her right wrist and then died 2 weeks later. So she just thought she was following the pattern of her mother, and in fact was in doing some therapy sessions on family relationship and constellation. It was healing repetitive family constellations. This also would tell me the blue field is so small, she could quite possibly have decided to go because her fear was so great, not because she had some disease to die, but just because her fear was so great. This lady now is a pattern that I wanted to show you what happens to the blind spot. So there's her right eye. This lady was, she'd had LASIK. She was stressed and pressured, financially very stressed. Her vision had started to deteriorate again, so she wanted to just improve her vision without going on to glasses. So that oval field says you've got somebody who is hyper, or who's doing this. You know, their emotions are very labile. Then on the left eye, so diminished field, but very unbalanced, because even if she was oval on both sides, it would be better than being oval on one and sort of more round on the other, because that's just more of an imbalance in your system. So you look at the blind spot there, so it's kind of oval on that one and rounder and more the shape, in fact, of the white field on that one. So then we started light, and she began to improve. So her blind spot just became better, and of course, I mean, this was a remarkable improvement, and she certainly felt a huge amount better than the left eye. So even though she was feeling better, her field was getting bigger, it felt like it was the right light program that I had. There's a break, and the break is in the mouth area on the internal. So she wasn't expressing her internal desires or needs. And so even though light was expanding her field, in the process of doing that, she had to make some shifts in order to expand, or make some compensations. And so as you go through a journey with somebody in light, you will find that I have found that they can say, okay, I'll get bigger, you know, but not there. Leave me alone there, you know. And so you carry on with light. She carried on, and still her blind spot looking normal, but then all of a sudden the right eye then changed. Now this is the survival area, so it's fear and survival. So again, it's, oh my God, you mean you want me to be that size? You mean you want me to bare myself and be completely exposed to the whole world, because that's how it feels after you've been there? And so that break in the green line signified to me that, okay, she wasn't enjoying. Then I would slow down the light process and say, okay, let's do this once a week, maybe, or have a break for a week or so, and and certainly do some talk around that process. And then on the left eye, so on the right side she had broken on the fear survival, and the left side is the sort of connection to life zone again. How can I do this? Apathy. Oh God, I don't have the energy to actually go forward in my life. So then we do the fourth field. Now look at the blind spot. And then in the other area that's broken is emotional, and it's sort of liver area. She'd had 2 deaths in her close family relatives within the 2 weeks since we'd previously done her field. So again, even though her field was opening up, she had to make some compensation in order to deal with it. And look at the blind spot. So even though her field was opening up nicely, her blind spot was telling me, I don't like this, I don't want to go through anymore. And in fact, we did stop then because she didn't need any more light, and it wasn't appropriate at that time. This guy had tinnitus, severe headaches, non-stop headaches. Where is he? Family difficulties, overwhelmed by his responsibilities. And again, the broken area is in the line of responsibility. Then on his left side, same chart, same day, that area is the spleen, and tells me that he's got a lot of anger and rage underneath there, that he's just unable to voice what he really wants. And so he has to somehow shift it because he still couldn't find a way of expressing his needs and desires. Heartbroken. I have to admit to this being mine. I got over him very quickly. But it was one of those times that I decided to do a field on myself because I had pain in my chest. I've never had heart problems, and didn't really connect it because you don't when you're doing it for yourself. And I couldn't understand why. I just couldn't see the green target there. So I kept going backwards and forwards and thinking, I don't know, I need to have my eyes tested, or I've got the wrong glasses on, or anything external but not me, you know. And then I sat back and stuck my chart on top, and I thought, okay, heart. So, and there's a beautiful cork. This lady, terrifying perfectionist, couldn't do, it was almost impossible to do her field. She kept moving. She was terrified that she'd done it wrong, or maybe, you know, she could have done it a little bit better, or did I know what I was doing, and had I got it right, and then that was her left field. And she'd already come to do like 2 years prior and just decided, nah, it was a complete waste of time and not really, didn't work, you know. And then she actually managed to stick to it. Her field looks so much better there, but again, breaks in the area of survival and fear, and also because her issue was really needing to be loved more by her husband and not being able to express there in the relationship and verbal expression area. And she voiced never having stood on her own 2 feet. So she didn't want to get divorced because she was terrified of being able to survive on her own without her husband. And all of that area there is about it's acute emotional stress, that diminishment there. It's around the back on the left side. And she was in acute emotional distress at that time. This field also was, it's as scary for me to do as I think it is for them, because I realized as soon as I put my pointer in there, and in fact John Pulaski said to me right way back when I first spoke about this, he said to me, yeah, he'd just taken a pointer into somebody's field, and he said she immediately, she sat back and burst into tears and said that her father used to hit her and he'd come from that side. And, you know, so anything coming into her field on that side was a trigger for that. And so this woman, I bring the target in, and it's, oh crumbs, what have I got here? What's happening with her? So she'd bounce backwards and forwards and start doing this, and then she burst into tears and she just said that she had suddenly remembered being beaten by her father until she wet her pants, and it triggered the memory instantaneously for her. I'll move on because again, this lady looked anorexic, didn't tell me. She sat there. I didn't, this doesn't look like it, but what happened was she started to spiral in. So the field started to get small, and I realized she was looking at me in fear. She was looking at me almost through little slits of eyes that said, don't go there, just don't go there. So I didn't even mark on the chart because she would just have spiraled into a little hole. And she also, I got the sense that all she wanted to do was just slice herself into pieces because she was not perfect enough to do this process. Another quark. This is what I call, in the 33 military strategies, this book, Sun Hai-Chen says, when a rash movement leads to exposure of the shape of the army, it will fall victim to the enemy. Prefer stillness to movement. It reveals no shape when still, but exposes its shape in movement. Therefore, a wise man treasures stillness. And stillness is a movement, actually. Stillness is a way to come and present yourself, but to hide. And this is a field of stillness. Even though there's a diminishment there, which says she's not expressing herself, again, it's in that area. But she said, I've got a few headaches. And then the next time we saw her, she just wants to do light, and how can it fix her up? And I'm not too sure that I really want to be here, but I actually want to be here. So we start doing light. In fact, then she said, no, it was debilitating migraines that she had, not just little headaches. And, well, yeah, she was kind of thinking of having a baby, but, you know, they were just thinking about it. And then, so then her field opens and she started to wander. And she described in her life that she liked always to walk with her husband, but to walk off the path. And they would each walk a different way, and they would sort of wander through and look at various things and always come back together again. And this is what she did in her fields almost throughout the entire process. That area that's diminished there is the sort of liver, giving, receiving, but it's also the sexual organs there. So then, before she had said, I don't want to have a baby and my husband does, what became clear is, because there is also the sexual organs around there, is she had problems in this area, and certainly with her sort of sexual and reproductive organs. So we go through, but her field continues to improve, and her blind spot suddenly changes. This was the last field that we did. That's the right. And there's the left. So her field expanded enormously, but the two areas on the right and on the left just became more. So the bottom area there is really about decisions, birthing decisions from Denny Johnson's work. And then on the left side is, sorry, wrong way. The left side is again acute emotional stress and also sexual organs and decisions. Also there is the heart, And she said, no, I don't want to do any more of this. I don't know, I'm not getting anywhere. And she said, even though her migraines had gone, and she actually, all of her symptoms had gone, but she'd been to see somebody who did a past life regression on her and was told that in at least 2 other lives, her husband had left her and their child. And so she had this, she left angry, in actual fact, that I hadn't been able to give her an answer. Should she have a child or shouldn't she have a child? Should she do what her husband wanted or should she not? So she left kind of still angry, even with this field that looks big, but with distortions in it that just say she hasn't actually touched on the area that was crucial and that she came for in the first place, but didn't talk about. Sorry. This is a breast cancer chemotherapy, and this is one that I pulled out because the next one is the person who I discovered this in. But so I went back into some files, and this lady had a lot of chemotherapy. She's not in a good. She's also got something called Tietze's syndrome, which is chest pain that you get after having had chemotherapy or and surgery to your chest area. So she's externally remarkably well. You would not imagine that her field looked like that. This was the lady where I discovered that a white field diminishes with toxicity, or certainly with chemotherapy. She came, breast cancer also, had been going through chemotherapy, but she'd finished that and she was on Zoladex, which is an injection every however long, I can't remember however long. She hadn't had one for a while, and she was about to have her last one. And this was before she had it. She expressed feeling browbeaten at work, so this was in our discussion before we did the field. And in fact, she looks browbeaten there in that with her relationships. That's exactly how it expressed. Then she came back a few days later, having done some light, and suddenly, where was it? No, it was the second. You could see the white field's quite high there, second of the 4th. And yeah, this was 7 days later. She did some light, but she'd also had her final Zoladex injection 2 hours prior to this field. So even though the white field had increased on the horizontal line from that, it had decreased on the vertical axis. And that's where I think we see chemical toxicity, is along that axis. Then, that was the 9th of April. Then we go to the 15th of April, and she had described to me that always after her Zoladex injection, she felt stupid in the head. She could only describe it like that. And that really showed exactly how she was feeling at that time. The white field just diminished. Okay, I know we've got very little time. I'm almost at the end now. How are we doing? Oh, I'm over already. Okay, this brain state technology is used. A lady went through having electrodes where they renormalize your brain state, and her field opened, and she also went through distortions throughout the process. So it was quite a journey. And then her final field was huge, but her blind spot shifted incredibly. I mean, it was just crazy, and she was quite traumatized after that. This is the last slide, and is actually my field again, pre-surgery that I had last year on my back. I had a near-death experience during that surgery. I happened to do my field just before I had the surgery, and so you can see the green field is smaller, and I was really stressed. I had only a month to prepare and was only told a month prior to it that I was going to need to go in, so it was very stressful. So that was the right and the left eye. And then about a month after surgery, suddenly my blue field was much smaller than the green. And this is a month after the surgery. Now, I looked at that. That's never happened in my field before, and I haven't had a near-death kind of experience before. I go back in my charts to a lady who had AIDS, whose CD4 count was incredibly low. She really was on death's door, and her blue field was smaller than all of the other fields well. So I think the blue field is kind of an indicator of desire to die or need or an unconscious process that we go through. And that's all. Thank you.
Thank you.